So I had a really good friend review this video and he recommended that I share a story. And so that is what I'm going to do with you today. So this story takes place in a care facility that I worked at as a housekeeper. And before that, I was a CNA. And I walked into the room. This fellow, he was having his medications rearranged and changed. He um, and so he had a lot of confusion. The nurse, uh, I could tell, was just talking to him, and he was up. So the nurse and the patient were both up all night, and so the nurse was understandably grumpy. So I could see his side, but I could also see the patient's side. The patient was stressed. He wanted to go home. He didn't know why he was there, and so I told him. So I said, "Hi, how are you?" He's like, "Oh, I'm terrible. This is awful. How do I get home?" And I said, "Well, you're gonna have to talk to your doctor about that. I don't know. I'm just your housekeeper." And I said, "How about some light?" I didn't even ask him if he'd like some light, but I just know that just opening up the window really helps. And he said, "Wow, it's morning? I thought it was night." I said, "Yeah." And it looks really nice out there. It looks like it's snowing, and you have some, but it looks like the leaves are starting to come through. And then I asked him, "Hey, what did you have for breakfast?" And he said, "Oh, I had some oatmeal, um, and I had um, some eggs and bacon." And he then I said, "Okay, well, let's see if there's something that we can do to get your TV working." And he said, "Oh wow, I am I'm so grateful. I at least have one friend in this whole place." And I said, "Oh well, I appreciate the compliment. I really try and be kind to everyone. This is an example of going through the five senses, and so uh, I opened up the window so that he could see some things. I opened up I asked him about what he ate, to taste and smell, and also the television is something that you can hear. And I didn't share with him what you can feel. I didn't know how to ask that question, but I could tell that just based off from those things that I could validate his feelings. And I've told a lot of patients this. Uh, I when they especially when they say, "Oh man, there's so much stuff on the floor. I'm so sorry that you have to sweep this all up." And I said, "Well, I got the nurses back so that they can help your back." And they just laugh. They think that's just so funny. But it's true. I do. I have the nurses back, and I tell them, "Hey, the nurses, they're working on you, and they need to keep their hands clean. And so they're not going to pick things up off from the floor. That's where I come in and I clean those things up." I hope that helps to understand why I'm sharing these things. A good reference would be Dr. Mike. He says that in one of his videos that a lot of people should know how to talk to people, and not just doctors. And with care facilities, you don't get to see the doctor very often. It may be once a week, once a month. It's very, very seldom. A nurse you can see very, very quickly, and CNAs you can see most of the time. When you're in a care facility or a rehabilitation center, which I've worked in both. Uh, so uh, those are some things to help be able to relate to what I'm sharing here. Hi, today I'm going to share with you something that I have skilled myself a lot in, and that is mental first aid. And the reason why I'm sharing this with you is because it is something I know a lot of people need to know more about. Mental health is critical for others, and there are more people who need to think about their mental health more than we realize. It's not just for those that have what is usually called a mental illness, and you shouldn't be scared of those people. You should get help in helping those people. If this is an emergency, then please turn off this video and call 911 or the suicide hotline and get yourself some help. This is more of, now what do I do after I've gone to I've done all that, and they've told me to do these kind of things, but I don't remember exactly what they are. And so, because I've done this a lot with the kind of work that I do with those that have developmental disabilities and those that are elderly, I work with those people a lot every day. And so this is more on the lines of, they have anxiety and they need some help with that. You can also, if you're having anxiety, then I'm hoping I can help you out today. So we are going to first think about a square. Then we are going to think outside of the square. Why? And I'm going to ask very few questions. I don't want to stress you out more than you already are. So I'm going to answer most of these questions. So just let your mind flow. Why are we thinking about a square? Because we have these new feelings that are wounded feelings that need our attention. They are crying out in unbearable pain and fear. They need something to hold them back in, to stop the bleeding and relieve a little of an unbearable pain. You do this by physically putting your hands on your chest in a butterfly shape, just like you would making a butterfly shadow on the wall. Only this butterfly you're making is putting light into your soul. And I would do this with both hands, but I'm holding the other hand with my phone. Then you use this mental square to breathe. 5 minutes in. 5 seconds. Hold it for 5 seconds. Let it out for 5 seconds. If you can't do 5 seconds, just do what you can. Then hold it out for 5 seconds. Then breathe in. 5 seconds. So keep doing that. That is to make your body so that it stops breathing very quickly and starts breathing deeper breaths, so you get more oxygen to your brain. If you start yawning, this is a great thing, because that means that your body is starting to transition from panic to calm, and that way you can keep going. So keep deep breaths and start thinking about these things. We're gonna clear out your 5 senses. The first thing is what you can see. And I usually ask people questions, but I'm not going to do this because I don't know what kind of state you're in. So I'm just going to answer my own questions. First, two things that we see. First is a butterfly. I've worked with a lot of butterflies, and they're wonderful. And I've hoped that you've been able to see butterflies too. And I'm pretty sure you already have. And just think about the colors and just say it out loud about those colors on those butterflies that you've seen. The second thing is two things that you can hear. Think about your breath and how you're breathing right now, and your fingers on your shirt moving slightly. That lovely noise. And then the third thing is a taste. So think about what you just ate recently and what you drank. If you just drank water, just how cool it was and how wonderful it was. Okay, now the fourth thing is what you can smell. I know that around where I live there are roses, and I love to go on walks and smell the roses and just really enjoy the nature around me and see what I can smell. Sometimes in the winter time, there isn't any roses, but the trees are still alive, and there's even moss that's growing on them, and they have a very interesting, pleasant smell, I think, anyway. So just find the north side of a tree and enjoy the what you can see and smell there. Uh, and the fifth thing is what you can feel. So just going back to the butterfly on your chest, just rub your thumb back and forth on your shirt and just feeling how your shirt feels, whether it feels soft or hard. And also if you have a zipper on there or buttons, just feel those so that you just become more connected to what is around you currently. That's the whole point of clearing your senses. And you're still gonna most likely have anxiety, and you'll need to go and see a therapist about that. There's a lot of great therapists. They can do a lot of good work, and you can ask them the kind of therapy that you want, more of validation if you just want to talk to someone, or if you are looking to correct things in the way that how you think, then that's cognitive therapy, and that is really good stuff as well. So just appreciate all of you, and thank you for watching this video, and I really hope that it helps you and enriches and saves your life, or it can enrich and save someone else's life, even if that's just one little bit at a time. And that's important, just to be able to savor the moment and to see and to realize there's life out there that's worth living. And sure love you all. Bye.